My name is Caroline Kotze. I am the president and founder of Women in Governance, and I'd like to welcome you to this CanWaCH conference, Beyond 2020, an agenda for Canadian leadership in women and children's health. It is a huge honor for me to be here today. I do a lot of work around women leadership, different from what we're doing here today, as our goal is to bring women to the executive level in decision-making bodies, but also very similar because there will be no justice, there will be no equality if we don't touch every woman at every level. I've also been very involved with different organizations for women's well-being, such as the Women's Y. I'm based in Quebec, and I'm also governor of Le Chaînon, which is the largest home for women in difficulty. So I do see a huge responsibility for business women and business leaders to also take such topics at heart. So before anything else, I'd like to acknowledge that we are meeting on Indigenous land that has been inhabited by Indigenous peoples from the beginning. We're grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. In particular, we acknowledge the traditional unceded territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We raise our hands to contributions that Métis, Inuit, and other Indigenous people have made both in shaping and strengthening this community in particular, and our province and country as a whole. Miigwech. We will be endeavoring to run on time, and that means quickly moving in and out between sessions and breaks. This is very important. Programs are posted outside the plenary room, Confederation Ballroom 3, and on the other side of the elevators on this floor, Governor General Ballroom 2. There are also some printed programs on your tables. The entire conference proceedings are being watched live through webcast in both English and French, and the recordings will be posted on the CanWaCH YouTube channel a few weeks after the event. We encourage you to use the conference app on WOVA to keep up to date on the latest conference happenings, including the complete program, speaker profiles, delegate profiles, and a community board where delegates can exchange messages, post photos, and more. Last year, the CanWaCH conference was trending on Twitter. So let's do it again on both Twitter and Facebook. Follow the conference hashtag, hashtag CanWaCH2020 or hashtag CanSFE2020. There will be an audience Q&A included with almost every session, and 2 microphones are located on the plenary room floor. It's important that you use them so that the translators offering simultaneous translation can hear your questions. Talking about that, don't forget to pick up your simultaneous translation headsets. They are located at the back of the room, and it's very important because some people will be speaking French today. And of course, don't forget to return them at the end of the day. I would now like to introduce Stanley Zlotkin. He is the Chief Center for Global Child Health, the Hospital for Sick Children, and a professor of pediatrics. He was awarded the H.G. Heinz Humanitarian Award, the CIHR National Knowledge Translation Award, and the Order of Canada for his contributions to improving the lives of children globally. Dr. Zlotkin.
Thank you, Caroline, for your very kind introduction. On behalf of the Board of Directors of the Canadian Partnership for Women and Children's Health, I'd like to thank you all for joining us here in Ottawa for our annual CanWaCH conference. It was just under a year ago we were gathered down the street for the CanWaCH Global Adolescent Health Conference. That dialogue brought together our membership, the sector and government, as well as our partners, including the United Nations and the World Health Organization. We explored how all countries can best work together in our approach to health during adolescence as a key stage of life. This year, our focus is different, a uniquely Canadian focus. At this year's conference, our sector is going to pause briefly, take stock, and look at where we've arrived, what it took to get here, what worked, what didn't, and what did we miss. And then we're going to figure out together where we need to be, what we have to do to take us there. And this is the perfect opportunity to do it. We have all the key contributors to success here in the room with us. We have NGOs, civil society, academics, health practitioners, researchers, youth, community leaders, and government. Many of our organizations are beginning to plan programming and projects for Beyond 2020 with the understanding that the global health and development landscape has shifted. We know we need to shift with it, but we need to know how. The Sustainable Development Goals and Canada's Feminist International Assistance Policy, FIAP, set ambitious targets and a bold vision. Over the next 2 days, as we are discussing and debating health in the context of these two critical policies, I'd like to suggest we think about health in its very broadest terms. As a pediatrician, my daily life may involve defining health as the identification, prevention, and treatment of diseases of children, but clearly health is much more than that. We must think of health as beyond the physiologic notion of wellness and disease eradication, but think about empowerment and how empowerment affects health. We must think about how access affects health. We must think about democratic opportunities for change and how a focus on democracy also affects health. Last week, I came across two examples of female empowerment and health in its very broadest sense. How am I going to do this? There. This is a great picture of a young girl playing baseball in the Globe and Mail last week. I didn't know it, but this article was about the very first all-girls baseball league in Canada. Before this baseball league was formed last year, if a young girl wanted to play baseball, she had to compete with boys in an all-boys baseball networks. As a baseball fan, I think young girls playing ball is great. What I didn't realize is the impact of girls in sport on their overall well-being. What you can see from this slide is that the consequences of girls in sport are actually very far-reaching. Aside from the physical, social, and psychological benefits of sport participation, studies show that girls who play sports are more likely to graduate from college, find a job, and be employed in a male-dominated industry, if they want to be. Research from Ernst & Young also shows that among senior businesswomen in the C-suite, 94% played sports, and over half played at a university level, pointing to a correlation between female participation in sports and success in business. I have a second example in an article that was published in the American Journal of Clinical Nutrition in March, that is last month, called "Maternal Employment in Low and Middle Income Countries is Associated with Improved Infant and Young Child Feeding." Promotion of women's employment is an important gender equity, women's empowerment, and continued economic development. Employed women are likely to spend their earnings on nutrition-enhancing purchases and allocate their income towards their children. However, constraints in women's time imposed by employment may pose a potential challenge to caregiving and infant and young children feeding practices. As more women in low and middle income countries are expected to join the labor force in the coming decades, it's important to understand the relationship between maternal employment and infant and young child feeding behavior. So using cross-sectional samples from 50 demographic and health surveys, the authors investigated the association between maternal employment and IYCF among 100,000 children aged 6 to 23 months. Mothers were categorized as either being formally employed, informally employed, or non-employed. And they used meta-analysis to pool associations across all countries and by region. And the results are shown in this next table, and I hope you can see it from the back of the room. In this table, we're looking at pooled odds ratios, and on the left-hand side, we have formal employment and informal employment versus those who are non-employed. The first important outcome is that whether you're formally or informally employed, the likelihood of your child being exclusively breastfed is no different than you were non-employed. So being employed does not have a negative impact on exclusive breastfeeding. The other thing it shows is that if we're looking at the children of these women, the pooled odds ratio for either minimum dietary diversity or minimum meal frequency is in fact improved if the mothers of the children are either formally employed or informally employed. So for example, there's a 47% likelihood of an improved minimum diet diversity if the mothers are formally employed, or an 11% increase, also statistically significant, if the women are informally employed. Similarly, for minimum meal frequency, if the mother is employed, there's an 18% chance of a better meal frequency for children, and a 15% if the women are informally employed. Overall, the results suggest that formal employment has a beneficial effect on children's diets across all countries and in most world regions. Thus, women empowered to work formally or informally end up with children who are nutritionally healthier, a really important outcome. Over the next 2 days, you will have the opportunity to roll up your sleeves and dive in during the interactive sessions. We are fortunate to have a great lineup and diversity of speakers, but we also need to hear from each and every one of you in the room. That's all of us. So don't be shy. That means coming up to the floor microphones during the audience question and answer periods. Make full use of the networking opportunities during the health breaks and during lunches to talk to fellow delegates, especially ones you've never talked to before. I'm looking forward to the next 2 days and to speaking to as many of you as possible. And I'd like to thank you in advance for your contributions and for your full engagement. I'm going to now turn the stage over to my friend and colleague, Helen Scott, who's the CanWaCH Executive Director, to share some highlights on the work we're undertaking with our member organizations and our CanWaCH associates. Helen, the floor is yours.
Thank you, Stan. Good morning and welcome, everyone. It's great to see so many familiar faces and a lot of new faces here today, so welcome. I'm very pleased that we can all gather and have this opportunity to really think through what is it that we're going to be doing in our global health work. And as Stan has articulated, this promises to be an engaging and energizing 2 days as we really think about what's next for all of us. I'd like to start by thanking Caroline Coetzee for agreeing to be our guide and to keep us on track. And I'd like to thank Gavi, the Global Vaccine Alliance, for the support of this event as a friend of the conference. And of course, we'd like to thank our colleagues from Global Affairs Canada. This work would not be possible without your support and partnership. And I think for, all of us here know how hard you work to make sure that this all happens and that our work happens. So we'd like to say thanks to you. What I love about getting together with this room of people, and so many of us have worked together now for many years, is that it's starting to feel like a bit of a community or a family. And we seem to have a shared history because of our work together collectively over the last few years. And like any family, we have our ups and our downs, our disagreements and the places that we agree on. But what's always so exciting is that we're always willing to passionately continue in our work, argue our case, and think through what's the best way we can do this work, because we have a shared common goal. We see a world where it is as unlikely for a woman to die of childbirth or during childbirth in Nambia as she is in Gatineau. We see a world where a child in Ghana has the same access to a vaccine as a child in Fredericton. And we see a world where Indigenous, Métis, and First Nations women have the same health outcomes as me or my sisters. We're also brought here together and held together by a strong sense of accomplishment. We all know the statistics. Maternal and child mortality rates have dropped dramatically in the last decade. And millions of women now have access to modern methods of contraception, which is life-changing and community-changing and nation-changing. And this is happening in regions of the world where it was unheard of 5 to 10 years ago. But I don't think it's the statistics that bring us all together. Rather, it's the stories in our hearts. I have a really unique vantage point, and I know a lot about a lot of the programs where you're working. And I know that you have all shared strong friendships and partnerships that you've created with community leaders and thousands of communities around the world. I know that in your hearts are the stories of the women and the children who access the programs that you run, whether it's in nutrition, obstetrics, or midwife training, or supporting local women's groups to access health services. Our individual stories are all so different, and yet they weave together to tell a common story of a collective Canadian journey. We've all accomplished a lot together, but our journey is far from over. And this is why we're here today, to plan for our next steps and to renew our energy to dig in and do this work collectively. So I'd like to take this opportunity for just a few minutes to talk to you about what our Secretariat, CanWaCH, is doing to support our members, all of you, to amplify your capacity to plan for the future. So the first step is this conference. We're delighted to bring you all together to think and really map out what is it that we'd like to do together beyond 2020. In the fall, we'll be hosting our AGM with Canadian Society for International Health in Toronto. And we've held many events and brought our members together numerous times over the past year. For example, with the coast-to-coast health proposal writing seminars for Global Affairs Canada proposals. We've conducted public opinion research on Canadian views on investments in women and children's health. And we've shared that research with all of you to help you do your own public engagement and communications work. We developed a guide to using the CanWaCH member portal so you can share the information about your programs with each other. We've conducted webinars to share members' methods of measuring success in communications and public engagement. We're working with Global Affairs to convene the members and other Canadian organizations who are working in Haiti to develop a dynamic network of coordinated and effective organizations working together. We played a matchmaker role, where we've brought many of the organizations together for an information session on the call for preliminary proposals for the Her Voice, Her Choice funding, and look to link partners with each other who might be compatible to apply for the funding. So those are just some of the few ways we've brought people together. In addition, we've enhanced our website, as you may know, so that members can easily upload their own project data, news, events, resources, and more. And it seems kind of geeky, but it's a highly trafficked website. It's a great way for you to share with our sector what it is that you're doing. Our innovative Project Explorer is where you can learn in detail more about the amazing work our members are doing in thousands of regions around the world. It now captures detailed, disaggregated data about Canadian efforts toward achieving the Sustainable Development Goals. And importantly, we're going to leverage the outcomes and learnings from this conference, these 2 days, and the conversations we've had in the lead-up and the planning, and the conversations we're going to have following the event, to release a policy platform that will make it clear about what needs to be done to close important gaps in global health. And then lastly, and very excitingly, I'm excited to share that today we're going to announce that we'll be launching our call for proposals for the first Canadian collaborative in global health. With support from Global Affairs Canada and in partnership with diverse Canadian and global organizations, the collaborative will achieve 3 broad objectives. It will investigate Canada's ongoing work in critical global health and rights areas. It will incubate sector and community-driven solutions to urgent challenges, and it will inspire the next phase of Canadian leadership in global health and gender equality. And as I was walking in the room to get settled this morning, one of our colleagues from a research community said to me, "You know what Canada needs to do?" And he kind of outlined that. So this is a little teaser on what we're actually doing, as someone had articulated earlier. We hope that you and your partners will join this innovative network as we work collectively to achieve the global goals of health, equality, and dignity for all. And for more information and updates on the call, you can ask some of the CanWaCH staff, or you can visit our website. And if you've downloaded the conference app, and I strongly encourage you to do so, in just a moment there'll be more information about that call for proposals. At CanWaCH, we don't let geography stop us. This is a huge country. And as wonderful as it is to get together in this room in a capital city, we know that so many more of our colleagues are working in communities around the world. CanWaCH ourselves is a virtual network, so our staff are actually located across Canada. And we try our best to leverage technology to work to ensure that our members can access these important tools, resources, and opportunities no matter where they're located in Canada. So that's just a little bit of a summary of some of the work that we're doing. But one thing I didn't mention is the tremendous amount of work that we've undertaken in the past year to support our members' ability to engage Canadian about our stories and our impact with a partnership-wide public engagement campaign. So today I'm going to give you a sneak peek of what's to come for that campaign, which will actually be launched in May of this year. Canadians have a strong history of leading in healthcare around the world. How many of you knew that Canada is one of the top donors in global health and nutrition? And yet the average Canadian, and our public opinion research shows this, does not know that Canada is taking a lead on advancing women and children's health, both globally and here at home. So we are looking to work together to change that. We want to start engaging Canadians, working with you and the incredible reach that we all have by working together. And we want to mobilize this effort so that Canadians start to understand the importance of investing in women and children's health. We believe that we can do that by sharing those stories that I talked about earlier and sharing the impact that we're having, which should be a deep source of pride for Canadians. So today is just a glimpse into the platform that has been created through a robust consultative process in collaboration with our public engagement working group and many of the communications leads from your organizations. It's been tested with a sample of Canadians. And the campaign is grounded in solid research, as I talked about earlier, about what Canadians think and where they're at, and it puts our members' needs, your organizations first. So I want you to enjoy the campaign manifesto. It was written with you in mind.
You've probably heard of insulin, the pacemaker, and advancements in treatment for HIV. These are just a few of Canada's great accomplishments in making the world a better place. A proud achievement you may not have heard about is that Canada is leading the way in championing the health rights and needs of the world's most marginalized people through a unique partnership of Canadian organizations and individuals. We've achieved a lot, but there's still work to be done so that all women and children, no matter where they live, can access quality healthcare and thrive in communities around the world and here at home. Until now, Canada's commitment to take the lead on global health has been our best kept secret. It's time to change that. Lead on, Canada.
Lead on, Canada. We're really excited to launch this campaign in May, and we hope that you are equally as excited, and we really look forward to seeing what we can accomplish when we try to do something like this together with 100 organizations that are partners with CanWaCH and all of the reach that we have in communities across this country. So before I end, I'd just like to take a moment to recognize the valuable time, insights, and commitment shared by our Public Engagement Working Group. Not all of the working group members are here with us, but I was wondering if the Public Engagement Working Group members who are here could just stand up. Give them a round of applause. Many of them are already standing in the back, I see. It's a commitment to their dedication to working. They're on getting these messages out. These dedicated individuals have represented the members' voices and needs diligently throughout the campaign development. They'll be available for questions that you may have about the campaign, so please feel free to seek them out. I also encourage you to visit the social media booth next to the escalators on the floor as you came up. Use the campaign photo props to begin to build the excitement about Lead On Canada. The campaign's official launch, as I mentioned, will be in mid-May, but let's start to share our incredible stories together starting now. Thank you.
Helen Scott and Stan Zlotkin, thank you so much for your very enthusiastic and engaging remarks. And that video was just unbelievable. I was fortunate to be the moderator of the panel last year for Her Voice, Her Choice, with Prime Minister Trudeau, Minister Marie-Claude Bibeau, the CEO of Women Deliver, Katja Iverson, Princess Sarah Zaid of Jordan, and Dr. Joanie Bewa. So I was very privileged to see firsthand what Canada is doing for the world. Very, very moving. And I was brought up in Lebanon. I was born and brought up in Lebanon, so very proud to be Canadian now.